Hi, everyone. Welcome to our information session. My name is Sarah Stoddard. I am a faculty member here at the University of Michigan and also am co-director of the Training and Education Core for the University of Michigan Injury Prevention Center. And Taylor also is with us today, and she is a project manager for some of the education and training activities that we do at the center. So I'm going to talk to you a little bit today about our summer intern opportunities. So first, I want to share a little bit more about the Injury Prevention Center and injury a little bit more broadly. So the University of Michigan Injury Prevention Center is one of 9 injury control research centers funded by the CDC. The University of Michigan's received their first funding starting in 2012 and has continued to receive CDC funding since that time. Like I said, there's 9 other centers across the country. The commonality or the common pieces between all the centers is they have to provide 3 core functions. One is they conduct research projects specific to injury prevention. They do outreach activities, more to the community and providing evidence-based prevention strategies out to the community. And then they offer training opportunities. And that's training really across a wide range of trainees from, students to junior faculty and other faculty members, and also some community organizations and community members. And so, like I said, one of the summer intern program is one of the training activities that we offer through our center. So our center focuses on some specific areas, or we offer more research and opportunities in these areas, and other centers focus on other areas of injury. But the areas that we focus on are primarily opioids and overdose, suicide, youth violence, concussion, motor vehicle crash, older adult falls, and then we do have a little bit of a catch-all bucket of ACEs, which is adverse childhood experiences, and other emerging areas. So we do have faculty and researchers who are looking ahead and what is coming that will be important for injury prevention. And I would say, in that bucket, firearms is also falling into that. As well. So these are the areas that the faculty involved in the center probably have the most expertise in. So what is an injury? We really think of injury broadly as any unintentional or intentional damage to the body, and related to a number of sources listed there on the slide. And this is really the CDC and Department of Health and Human Services definition of injury, and that's what we follow. And you can see our figure here also just shares other ideas of what falls into injury. So why is injury prevention important? I mean, injury and, whether it's violence or other forms of injury really touches everybody. And, people potentially who have, fallen and broken something, or who, maybe have been, a victim of some sort of violence. So we know it's prevalent and we know it's preventable. So much of, the injury work we do and the injuries that occur can be prevented. Injury is one of the leading causes of death in the country. This figure shows if you look, across the top, it's broken down by age group, and then it ranks top forms of death. And you can see, sorry, I moved us ahead. You can see that for ages 1 to up to 45 years, unintentional injury is the #1 cause of death. And then if we think about injury a little bit more broadly, suicide is #2 for, adolescents and young adults, and homicide is then #3 for, our little bit older adolescents and young adult population. Address related to morbidity and mortality. So a few other kind of facts related to injury. One person dies from an injury every 3 minutes. We know that millions of people are treated in emergency departments every year, and many of those end up hospitalized related to their injuries. We spend a ton of money on injury-related both treatment and then also long-term effects. We know that there's loss of productivity, loss of the ability to work related to injury. So, in the long run, injury can cost an individual, but really society, a lot of money. Injuries, as we saw, is a leading cause of death in children. And then we know certain groups are kind of impacted by certain types of violence and injury more than others, with homicide being number one, particularly for African-American young men. So careers in injury prevention, you're here thinking about a summer internship, probably because you're interested in maybe kind of looking into opportunities in injury prevention. So there are a number of different opportunities, and we've had, kind of trainees that we've worked with and partners really that we have across a number of different organizations that do injury prevention work. So that can be at, local, state, and federal government. So we have partners at the county. We've had trainees go on to work at, the Michigan Department of Health and Human Services, at the CDC, but then also thinking about nonprofit and academic centers, hospitals and health systems. Michigan Medicine has actually a number of groups on campus that focus on injury and injury-related topics, just like other health systems do as well. And then at the private sector, there are opportunities to do injury prevention work. So like I said, what I want to primarily talk to you about today and what you're most interested probably in really is our summer internship program. So each year we do offer paid internships for students. This coming year, we're anticipating having 5 paid internships. These are really designated for graduate students or upper level undergraduate students. And we're really looking for students who are interested in pursuing an experience and potentially a career in injury prevention. They are really opportunities for you to engage with, whether it be kind of a faculty member and team in an academic setting, or potentially with a community partner, to really gain kind of mentorship and experience in either research or in practice-based kind of injury prevention. And our internship program does meet the requirements for the MPH practicum experience. And so if you are an MPH student, we do, you typically are able to use that experience to fulfill your MPH practicum as well. So as far as eligibility, you need to be a current student, graduate student, medical student, or undergrad that will, upper level undergrad that will continue to be a student through December of 2022. Our undergrad applicants need to be either rising juniors or seniors at the time of the internship. And then we do limit, one of our placements is with the CDC. 4 are typically local, and then 1 is placed with the CDC. Now, this past year, that was a virtual experience with the CDC, but we're hopeful that our students will be able to return to being able to go to the CDC in Atlanta and have an in-person experience. And for those CDC placements, it does have to be a public health graduate student. So we've had students from epidemiology go before, and behavioral health education. I think those are the 2 primary programs that we've had students from go to CDC in the past. Students from other universities are eligible to apply, but we do preference U of M students, but that does include U of M Flint and U of M Dearborn students. So we do open it up to the little bit broader U of M system. So these are some of the kind of places that we have had placements in the past. So we have placed interns right within our Injury Prevention Center on a number of either research or more practice-based projects that we have going on. We've had students collaborate with groups at the Institute for Social Research on campus or the Prevention Research Center over in the School of Public Health. We've had students at the Concussion Center. And then some of our external partners have been, the Health and Human Services at the state, the Detroit Health Department. I know we've had students collaborate with Washtenaw County Health Department in the past. So they are local and either in kind of the Ann Arbor, when we've been in person, if you are an intern in at the health department, that may be in Lansing. But as we look at placements, we also talk with potential applicants about the location of the placement as well. And then the CDC, as I mentioned, students have been able to go to Atlanta in the past to have an experience there. And there, students have worked on a range of kind of topics and kind of different things within the CDC. And it's really based somewhat on what the CDC has available for internship opportunities, but also we look at the potential applicants' kind of strengths and areas of interest and try to kind of help facilitate matching with an experience there. So interns are expected to work at least a total of 318 hours, which aligns with the MPH program practicum experience. And that typically is, we say 27 to 30 hours per week over a 3-month period, but that schedule is really worked out between the intern and their assigned preceptor. So there's some flexibility in kind of the hours and what that looks like. But it does need to be 318 total. We also require the interns to complete a massive open online course that we developed on injury prevention. And then there are typically weekly seminar meetings with the cohort that range from being kind of discussion-based groups to having people come and present. We have faculty come and present on different injury topics. We have previous interns or other people we know in the community that are in more practice-based positions come and talk about, kind of potential opportunities to work in injury prevention after you're done. So, but we ask that you participate in those seminars. And then after the internship is done, we do ask you to do a short presentation about your experience to the Injury Prevention Center faculty. And then also we ask you to do some kind of evaluation things with us, not overly burdensome, but we do. And then we do like to keep track of kind of what you do after you're done in our program, just to see if you do land in an interesting injury prevention position and to hear about what you do later. So you do receive a stipend for the internship. It is $1,500 per month for the 3 months. So it's a total of $4,500. And if you are a CDC intern and you do end up traveling to Atlanta for your internship, there's an additional $500 for travel. So applications are due December 17th. At 11:59 p.m. You email your application to Taylor, and her email address is here. And you maybe have seen our other announcements as well, and that information is also there. So eligible students can apply to both a local placement and a CDC placement within the same application if you're interested in both. So if you're interested in both, please note that. Make sure to tell us you're interested in both opportunities or just one or the other, but within the one application, you can kind of state your interest. You don't have to submit 2 separate applications. And like I said, our announcement also has more information about kind of the internship itself and the application process. And then once you apply, we look at your applications alongside the applications we get for students. So we get placement applications from organizations, from faculty who would like to have a student. And so then we look kind of at those, we look at our student applicants, and then we try to do a good match between what you're interested in as a student and what the placement needs. So in your application, if you can be as specific as you can be about kind of what you're interested in, what you'd like to do, what your long-term goals are, that helps us be able to match you with a good placement. And then our plan is to announce and to make offers for interns right around February 1st. We want to give, we know that people are trying to plan for their summer and are looking at other opportunities. And so we like to get our offers out as soon as we can. So I would expect to hear from us right around February 1st. And then I have a couple slides that just are kind of quotes from some of our previous interns that many, I think, if not all of them, one's still a student I see coming up. So I'll let you just read this and I'll flip through, and we've got a couple other quotes as well. So she currently works on a project right within our Injury Prevention Center on campus here. Flip to the next one. Brianne is a current summer intern, or current student, last year summer intern. And she actually continued to work with her preceptor this fall, and some of our students do that as well. Sometimes there's opportunities if you started something over the summer that's continuing, that you might be able to continue kind of working with that project later. No commitment to have to do that, but some students do find those opportunities to continue to have some experiences then during the academic year. And then this was our CDC student from last summer who did his CDC experience virtually, like I mentioned. And I would say our CDC interns have always had great experiences. When they go to CDC they always come back talking about just, how valuable and the great experience they had at the CDC. So, and we love that we're able to offer that to our students. Okay, so if you need more information, you can go to our website here. And this link actually is specific to our certificate, which we also kind of always want to promote a little bit. Oh, no, that's okay. So within our website, you would also find our our summer intern announcement. But this one actually probably important to also just touch on for a second. We also offer a certificate in injury science through the School of Public Health. And this internship also counts as the experience you need for that certificate. So if you are really interested in injury prevention, I would highly encourage you to look at the information about the certificate as well. And there's information on the Injury Prevention Center website. There's also information on the School of Public Health certificate website. And if you're interested in that, Taylor and I are very happy to talk to you about the requirements for the certificate. On the School of Public Health website, there are course examples of kind of what's required. If we also can do some substitutions for that. Sometimes injury-related courses come up across campus that are also a really good fit. And we can sometimes substitute those for other kind of requirements that are listed. So if you don't see the course you want to take on that list, reach out to us, because there may be ways that we can adjust that requirement for you to be able to complete the certificate if it's something you're interested in. So now I'm happy to answer questions. I can flip back to any information if you'd like to see anything else again. And thank you for joining us. And I can do questions in chat, or you can unmute and ask your question as well.
I have a question.
Yeah.
It says on the like internship description with the requirements that we need 2 letters of recommendation, and it can be from a current or former professor. Does that exclude GSIs, or should it just be professor?
No, I think it could be a GSI if if you feel like they can kind of speak to your ability, speak to your interest maybe in the area. I think that would be okay.
Okay, thank you.
Yeah. I saw a hand, Jackson.
Yeah, kind of going off of that, as someone that was looking at both this internship and the firearm prevention, injury prevention internship, as far as the recommendation letters go, because I just don't want to completely inundate professors with a bunch of stuff, are those like, I guess, do I need to be asking for these specifically? Like, should I be asking separate for these things, or is it okay to ask for a recommendation letter for either?
How to approach that? Okay. So I think, you could, the faculty member could probably write a very similar letter, honestly, but I would ask them to address it to each one separately. Does that make sense?
Yes, thank you.
Yeah,
that's what I was thinking of doing. I just wanted to make sure that was.
Yeah, no, but I think that's fine. And honestly, right, I mean, if that's one of the areas you're interested in, and that really does relate to both kind of injury prevention more broadly and firearms specifically. So I think they could probably speak to both in one letter, but I would just have them address it separately to each group. Yeah.
Okay, thank you.
Yeah, Anna.
Actually, Kamara put her hand up before me. So
I'm sorry, did I?
No, you're fine. But if she wants to ask her question first.
Yeah, okay.
Hi, thank you for the information regarding the internship. I had a question. I'm a first year MPH student. I was looking to declare my certificate in injury science, but I haven't yet. If it's not declared by the application due date, would I still be eligible?
Oh yeah, yep. So you don't have to, now we would love it if you want to do the certificate, but you don't have to do the certificate to apply for the internships. Now we might look a little bit at that and say, oh, yes, she is, she or he, or, they are also interested in the certificate, kind of showing really even more interest in injury prevention, but you don't have to have declared the certificate. And you could, if you haven't quite done it yet, but are thinking about it, you could address that in your application too, that you are, really interested in that as well, and are planning to take additional coursework to maybe, meet that. So I think you can write it in your essay as well. Does that answer?
Yes.
Yeah, but doing the certificate isn't necessarily a requirement to do the internship. So,
thank you.
Anna, do you want to go now?
Yeah,
I mainly see pictures.
I would just. I think I'm especially curious about what sort of background experiences, but then also if you could specify more about what kind of candidates you're looking for, like. Who are the people that you're trying to find?
Yeah, I mean, I think, and the experiences can range, I would say that. I would say, we have experiences that are much more about maybe working with data and data analysis and kind of, helping with some of those things. We have experiences that might be more creating educational materials. or helping to create educational materials, or helping with an active project, say with recruitment, or so I think it can really vary. And I think, as far as what your background is, I mean, you don't necessarily have to have, much experience in injury prevention, any experience really. I think it's expressing an interest and, talking about what you hope maybe to get out of it, kind of helps us place you. But, I think the experiences can really range. Taylor, what do you think? Do you want to add to that at all?
Yeah, I would agree. There's not like one specific type of candidate we're looking for. I think I think one of the more important things is like the statement that you send in with your application. So you can tell us about like your experiences and the type of summer internship you want and what you want to get out of it, and your interest in injury. I think that would probably be like an important part of your application versus like whether or not you have the right background experience, in my opinion, at least.
Yeah.
Great, thank you so much.
Yeah, I'm going to answer these couple that are in the chat quick, and then I'll come to you, Mackenzie. So there's a question about whether it's available to MHSA students or just MPH students. Any grad student can apply, and really any upper level undergrad student. I think, again, it's kind of talking about your interest in injury prevention and those kinds of things, but it's not limited to only MPH students. You can be a student in a different program. And then, so if you are selected to be an intern, you are placed right away with a project. So at the time we make the offer, we also tell you what the project is. So you will know kind of where you would be placed, or potentially a little bit about who you're working with. So we do that match right away. And when we make that offer, we tell you your match. Mackenzie.
Yeah, so I had a question too, then kind of related to so is the firearm injury prevention internships, would I apply to that separate? So could I apply to both?
Yeah, Taylor,
Okay.
That's correct, right?
Yeah. We're separate.
I forgot about that one. And so I didn't really, I should have asked firearm related questions to those people before. So yeah, you can apply to both. They are separate, but I would say probably the seminars and things like that, there may be some overlap that anyone doing the firearm internship may also be participating with the Injury Prevention Center kind of interns on some of the seminars and stuff. We have a relationship, with them. So some of that may overlap. Right, Taylor?
Right.
Yep, exactly.
Okay, thanks. And then, so for the letters, so it says the way they're listed for some of them, like, because I've gotten emails that say like both have to be from like faculty members, but then it also says that it could be like from an employer or anything like that. So I was wondering, so does just one have to be from a professor at U of M, and then the other could be from like a professor I did research with or something like that?
Yeah, I think that would be fine. I think I don't think they both have to be from U of M. I think if one is, but if you have someone that you worked with in the past, and could speak to kind of your skills and what your interest in those, I think that's totally fine.
Okay, thanks.
I think the best letters come from someone who knows you in some ways and can speak to kind of your abilities and your interests. So I think picking people that can do that is kind of how I would approach it.
Okay, thank you.
But we do like to hear from faculty because they have some sense too of kind of how you've been doing in your program and your classes. Do we have, let's see, more? Any other questions right off? So, but back, yes. So if you're interested in the firearm internship, you need to apply for those separately. So there's the two different streams. I think if there's anything else to know about. I don't think so. Are there any other questions?
Oh, I actually do have a question about the certificate. If I were to email you after, because I tried to pull it up to see like the classes to see if there's any offered this like upcoming winter semester. Would you be able to tell me like which ones are being offered this next semester?
Yeah, and I can probably forward you as well. If you want to email me, I can send you the certificate program, or at SPH, the people who kind of manage the certificates there also sent out, for those that I think had already declared a certificate, they sent out a list even too of what's being offered this winter. So I can pull up that list for you as well and forward that on to you. So yeah,
Okay.
if you want to email me, I can kind of provide some of that information too.
Okay, thank you.
Yeah, yep.
If any other questions come up while you're working on your application, feel free to send me an email and I can help.
Yep, and that's Taylor's email on the slide that we still have up. So, and she can also respond to certificate questions as well, and kind of any other questions like that too. So,
yep.
Okay. Well, if there aren't any other questions, we can end. And thanks for joining us. And the other thing I'll just mention, I guess, quick, is that you can also become a member of the Injury Prevention Center if you're interested in injury prevention. And it's a little application to fill out, but it's really not a big deal. And you don't have to have had experience either. There might be a question on there about if you did, but that doesn't matter. But what that does for you is it gets you on our listserv, and we send out information about events around campus and even broader, and kind of other opportunities. And so it's kind of a nice resource if you're interested in injury prevention. It kind of gets you kind of connected to some of the other things that go on related to that area. So think about that. And that's also on our Injury Center website. So. Okay. Well, thank you all. Unless there's any other questions, let me check the chat again. Great. Okay. Thank you so much.
Thanks, everyone.
Thank you.
Thanks.
Thank you.